All right, well, I'm going to go ahead and get started. My name is Mara Powell, and I'm our Chief External Affairs Officer here at Kentucky Youth Advocates, and we help run the Cozair for Kids Face It movement. And, we're excited. 10-4 Day has been something that we've been working on for 5 years now in Kentucky. So we're excited to kind of share some of our best practices and lessons learned and that sort of thing with you all today. And like I said, please continue to drop in the chat as you have questions or comments or feedback. And we'll make some time towards the end for folks to come off mute if they'd like to ask questions or to address those that you add into the chat. And we're recording and we'll be able to share that after today. So welcome. So the Face It movement, for those who aren't familiar, is an initiative that was founded and funded by Cozair for Kids. And we launched back in 2013 in response to the public outcry against the number of child abuse deaths here in Kentucky. And Face It strives to prevent and end child maltreatment through the promotion of best practices in prevention and intervention, much like the 10-4 rule, which we're talking about today, engaging the community, which we are also doing through this effort, and advocating for effective policies. And we have over 130 community partners across the state, many of whom are joining us today, which we really appreciate. So today, as you all know, we're discussing one of Face It's annual efforts, which is recognizing the 10-4 bruising rule on October 4th. So go to the next slide here. So each October, the Cozair for Kids Face It movement brings awareness to the 10-4 Faces P bruising rule with an awareness campaign and educational events surrounding October 4th. And since 2019, Kentucky's governor, attorney general, and dozens of local leaders have proclaimed October 4th as 10-4 Day, along with others. And we have several other states who are continuing to join the effort each year. In 2023, so last year, in partnership with Lurie Children's Hospital of Chicago and Mass General in Boston, 10-4 Day was also recognized by governors of Illinois, Connecticut, Massachusetts, and Michigan. And we heard from Dr. Chua this morning, who we've been partnering with for boosting the national presence of the bruising rule and 10-4 Day. And he shared with us that groups in Montana and New Jersey are making strides on their 10-4 Day efforts for 2024. So we're really excited to be able to continue to kind of grow this effort and, boost that awareness. And, like I said, we have several folks registered for this and who are joining us today from other states. So we welcome you. While we'll be sharing what Face It has been doing in Kentucky, I think we, hope to encourage you all to take the components of what we've shared to be able to learn how to organize a 10-4 Day in your state. And through this information session, we hope to share some tangible tips for folks to get involved in 10-4 Day promotion. And to give insight into Face It's 10-4 Day strategies and those interested in participating or replicating in their local communities or in their states. So we really appreciate it. That's just a little backdrop on 10-4 Day. And just a quick overview for those who maybe aren't familiar, like what is 10-4 even about? And just so a quick overview. And, we are an advocacy organization and, helping promote this rule. We are not the experts specifically on the bruising rule, but we wanted to kind of give a little bit of backdrop to kind of a baseline understanding. And we encourage folks to of course, dig deeper into the research. But as a quick overview, the 10-4 Faces P bruising rule is a clinical rule developed and validated by Dr. Mary Clyde Pierce and colleagues. Attention to bruising, especially on children under 4 years old, and especially those under 4 months who are not yet cruising, is an actual step that we can take to help identify children at risk of physical abuse and potentially improve the outcomes of these young children. 10-4 Faces P is an easy to remember acronym to help adults recognize the concerning bruising and patterns on young children that can be red flags for possible abuse. And this is just a little snippet of the brochure and the acronym for folks to be able to quickly reference and understand what the rule is talking about. And so, of course, we encourage folks to attend a training to learn more about the bruising rule and other indications of potential abuse, and then ways in which we can all intervene and help to prevent. I know Clarissa just dropped in the chat there the link to FACEIT's website where we house this resource and a short video about the rule, and then also linking back to Dr. Mary Clyde Pierce's research on that as well. So let's get into the nuts and bolts of raising awareness about TEN-4 Day and the TEN-4 bruising rule. So raising awareness has brought to our attention some of the sticky messaging that comes along with balancing the need for, of course, child abuse recognition and reporting, along with the role that positive parent engagement and strengthening families to prevent maltreatment from occurring in the first place. So kind of finding that balance there. We've tried to play up both the recognition and reporting, as well as kind of how we can help families, prevent or to intervene if there are red flags of abuse that are brought to the attention based on this rule. So the strategies listed here are among the ways we've been striving to strike that balance over the last 5 years of TEN-4 Day. And that's taking a multi and interdisciplinary approach. We leverage media and social media. We build decision maker awareness through proclamations. Our trainings offer tangible tools and information for those who work or interact with families. And we encourage our community-based partners to host positive parenting events to engage families during this time. And we offer free resources online and in print for folks to be able to equip others in their network. So we'll get into a little bit more about each of those now. All right. So FACEIT has emphasized the importance of multi and interdisciplinary approach and a collaboration. We need our pediatricians and other healthcare providers, their awareness of this bruising rule, but we also know the importance of others that families may come in contact with, such as social workers, EMS folks, law enforcement, especially our childcare providers and educators who see kids every day, and our businesses and just caring community members who come in contact, whether that's the child or the grocery store worker or the teller at the bank. There's always a role for folks to be able to play in recognizing, reporting, but also maybe de-escalating. So child abuse recognition and reporting is an adult responsibility, and each one of us can play a role in prevention, such as offering a helping hand to a family with a young child. So always kind of emphasizing the role of that cross collaboration and the role that all community members can play in child abuse prevention. Leveraging the media and social media is a key component in raising awareness, as you may guess. That's how many of us get our information. So just a few kind of pieces of information in which FACEIT has done through the years. We work with our media partners by hosting a press conference on October 4th for reporters to hear directly from our experts about the importance of the day and the bruising rule. We are joined by, Dr. Curry sharing about her perspective as a child abuse pediatrician, for example, so that media can hear directly from folks about the scope of the problem, how, folks can intervene, the importance of the training, and how this tool can help support folks in recognition. And then social media is an obvious tool for promoting the TEN-4 FACES-P resource and messaging, as well as the trainings and other events throughout the day. It's how we can, spread the word far and wide. FACEIT offers a social media toolkit on our website for community partners to share graphics and sample posts to their social media profiles. And I see Clarissa just dropped that in the chat for you guys to check out. Of course, for our out in the state folks, there are some graphics that may not make sense for you all to share if we're promoting our trainings here in Kentucky. But there's still some graphics in there and sample social media posts that you can use to be able to share those on your platforms if you're interested. We encourage folks to also just share directly from FACEIT's website or FACEIT's social media. If you're not already following us on Facebook, Instagram, or Twitter, X, whatever we want to call it now, we encourage you to do so and, reshare those to help spread the message and connect folks back to FACEIT. Another Another tool for leveraging social media, of course, if you have funds available with your organization, is to boost those posts on Facebook and Instagram, putting some dollars behind some of those posts to be able to get the targeted messaging out even further, whether that's to professionals who work with young children or families in your community. Putting some money behind those posts through boosted social media posts can really help target the information even more specifically. Some other ideas that we've talked about here at Face It and how we've helped facilitate spreading the word is an email blast to community partners and professionals in your networks, or several email blasts leading up to the day, on the day, promoting events and that sort of thing. Hanging flyers to promote 10-4 day and any other trainings you may host, whether that's within your community center, your library, within, the break room at a hospital, whatever it may be, hanging those flyers, and setting out those brochures, passing out our 10-4 bruising rule brochures to folks, which you can order for free on Faceit's website. We also encourage that. And then another idea when leveraging social media is requesting like some of the bigger entities that may be in your community to help spread the word. So sharing with them the sample social media posts with your local hospital systems or health departments, your universities, and other professional associations, like if you have local dental associations or nurses associations, to be able to share on their social media platforms. So it's not waiting for folks to come to you, but asking, those groups to share so that it reaches them where they're at. And another option is if you're requesting a proclamation of your local leaders, ask those local leaders to share about it on their social media platforms on October 4th to really boost that awareness on that day. And on that note, one tool, of course, that we've been talking about to really garner media attention, especially statewide and in local communities, is securing those local proclamations to officially proclaim October 4th as 10-4 Day. Of course, we can say it's 10-4 Day, October 4th, 10-4 Day. We as advocates can recognize that. But for it to be official and all of that, you got to actually make the proclamation in your state or in your community. So in Kentucky, like we've mentioned, we've successfully secured the proclamation from our governor and attorney general, as well as several mayors and county judge executives with the support of our community partners. And you can see several of those examples here from our 10-4 day efforts in 2023. And so while we've made, those requests, like Face It has made the requests for the state for the governor and AG, and then our bigger cities such as Louisville and Lexington, we really rely on our community partners to help us make those requests as the nonprofit leaders in their community. So, for example, our partners up in Northern Kentucky, Family Nurturing Center, has secured, our proclamations for 3 of the county judge execs up there. Our partners in Eastern Kentucky, Mountain Comprehensive Care, have done an amazing job of securing proclamations from county judge execs and mayors for several of those Eastern Kentucky communities. So we really appreciate that on the ground approach from our partners to be able to make those connections, because many of them as nonprofit leaders in their communities have those connections already to say, hey, mayor, can you recognize this day, partner with us and Face It to be able to promote the importance of this day. And if you're interested in supporting Face It and securing proclamations in your local jurisdiction in Kentucky, please let us know. We'd love to know that. Reach out to us. And on the website, on that 10-4 webpage, we outline the process for getting a proclamation. We have a template on there for a sample proclamation, as you can see it here on the screen. Several are using, very similar and language. So we offer that as a template. So it's super easy, as well as a template for a request letter that you can kind of update, personalize, that sort of thing to be able to send to your local community. So we want to make it as easy as possible for folks to be able to engage in this and make the request. So now I'm going to turn it over to Debbie to talk about our strategy when it comes to training opportunities.
Yeah, so we know so the education component, so having trainings is of course really important. So we provide CEUs for different pediatric abusive head trauma 10-4 trainings. We offer those. We provide CEUs for those because we know that there are certain professions that are required by law to have the pediatric abusive head trauma trainings. And so, for best practice for that, we do try to offer CEUs for several different professions. And so, thinking about those for other states. I know the process is different for getting CEUs. So, really, if you want to identify what professions you want to offer them to, not only required professions, but just those that you want to reach. So, like we offer a variety, EMS, nursing, social work. We have, I think, about like six or more ones that we offer for. But so once you identify those, then you would look at what the accrediting organization is, and then look into what the CEU application process is. And so, for those of you that are in Kentucky and you're going to offer trainings for something else and want to find out how to do that, I'm happy to share that information from other states. That's just what the process would be. We are offering, as far as training dates, we're offering one this year that's in the evening, and the reason behind that, so we offer virtual and in person, so that way it just provides more opportunity for folks to participate. Um, like I know last year we had an in person that had a smaller amount, and then a virtual one where we had 100 and something folks attend. So virtual does kind of have a larger reach. Um, so this year we're offering one on October 2nd from 10 to noon. So in the morning, one in the evening, from 5:30 to 7:30 on the 3rd, which that one is really, we wanted to make sure that childcare workers were able to attend. We were given feedback that that was a good time of day for those folks. And then we're having one in person that will follow our press conference on 10-4. Um, yeah. And then I'll just hop into positive parenting events. So, kind of the purpose for positive parenting events, we started this out a couple years ago of really wanting to pair not only recognition and reporting, but with the more upstream about primary prevention in collaboration with abuse recognition. And so we connect with our Face It partners who are more on the ground working with individuals and families to host what we're calling positive parenting events. And those events include something from the Strengthening Families framework. So, parental resilience, social connection, knowledge of parenting and child development, concrete supports in time of need, and social and emotional competence of children. So Face It provides a stipend to our partners to host an event. This year, if you host an event in September, or October, there is an application for you to host that. And I'll just give a quick few examples of positive parenting events that have been hosted before, because really it's thinking about organizations engage with families in different ways. So there's not like one set template for what you need to do, but what makes sense for the families that you serve. So I'll just give a couple of examples. We've had folks that work with families with special needs. They've provided either like a picnic in the park, a time of social connection, a self-care night. Organizations that have done cyber safety or a family dinner and mindfulness/yoga nights. A Lego building, really an activity that provided some STEM activities for parents and kids to do together, and like an art night. And really, just one thing that was, I'll say, a highlight for me as an organization said, okay, we want to build parental resilience. We're not really sure how, but we've identified that as something that we need to work on. So we were able to connect them with somebody who helped them find some activities that would build parental resilience. Um, so yeah, and now I'm going to pass it to Lynn from Family Enrichment Center, who she's going to talk about how she's leveraged, how their organization has leveraged various strategies to promote 10-4 in Bowling Green.
Hi, thanks, Debbie. Can you hear me?
Yes.
Okay. yeah, we're so grateful for our partnership with Face It. But our whole mission is to empower families and prevent child abuse. And Face It and 10-4 movement is certainly a big part of that. We've been able to secure proclamations. We have 10 counties in South Central Kentucky, and we have a good working relationship with our mayor's office and our judges, and it's been fairly just a matter of a phone call to say, would you guys recognize this? And they are happy to partner to do that. We've been trying to slowly reach out to some of the other counties, and we do that through partnerships with our Department for Community-Based Services or our child advocacy centers who work closely with some of those people who are able to convince them that this is something that they need to support. And it doesn't take much convincing. It's such an easy rule to remember and makes a big difference. We have worked with Face It to provide the parent activity, and we did an art and resilient night with our families. We focus a lot on birth or pregnancy to 5. So we invited all of our parents and in a couple of our programs to come and participate, and had stations where they could go and learn how music or yoga or art can be very helpful with their family and with the parents individually and the children. They all participated together. So that was a wonderful event, and we intend to replicate that as well in other counties. Um, One of the things we have done too is we had Dr. Mary Clyde Pierce actually come and do a training with our emergency room physicians, because sometimes it's just so hard to decide whether what you're seeing is abuse and neglect. And that training was very well received. There's a lot you can do, and it's not always money is not an issue if you partner and work well with your community.
Thanks so much, Len. Yeah, I think Family Enrichment Center is a great example of how you all are leveraging your community, your already established community partnerships and connections, and kind of balancing that sticky messaging that we talked about, where you're promoting the recognition and how to report and what are the signs of abuse, or potential red flags for abuse of young children especially, but then balancing that with these positive parenting event opportunities, and then of course training your folks. So thanks so much, Len. We appreciate your partnership so much, and appreciate you joining us today.
Thank you.
Yeah. I think now we want to open it up just our last few minutes here for any questions that folks may have. I haven't seen any in the chat, but if anybody has any questions, wants to come off mute or raise their hand, and come off mute, that would be great. We want to make sure we covered everything that folks may have. I think this is, like I said, kind of the strategy in which we've been putting into the 10-4 efforts here in Kentucky through Face It's work. But there's always room for growth, and we'd love to hear maybe what other folks have been thinking about doing. So, any questions or feedback?
I just have a quick question.
Yeah.
Um, so I saw the proclamation and I saw none has been submitted for Nevada, which is where I work.
Mhm.
And I was gonna submit on my own, but then I contacted the CMO in my hospital, and he's looking into it. Assuming my hospital approves of it and would like to be part of this, does it matter if I submit the proclamation on my behalf and just say place of employment Sunrise Children's Hospital, or should they be, or he should submit the proclamation?
That's a great question. When it comes to proclamations, we've typically done it through our organization. I mean, obviously individuals submit, but kind of backed by our organization. So I would, encourage, I think if if it would help the effort with your governor's office to have the hospital kind of sign on, I think that would be a great way to approach it.
Okay. Thank you.
Yes, absolutely. Thank you. We appreciate Nevada's efforts in this. We hope to be able to add a star to you all for our presentation next year.
So, we're trying hard in Nevada. There are no child abuse physicians, zero.
Wow.
I became the child abuse medical director for the hospital. I'm a PGR doctor, so I'm trying to get this going.
Okay. Well, we appreciate your efforts so much. And it starts with one person. So we appreciate you, yeah, doing that. And please reach out to us if you have, any supports that you need. Especially bringing this training, pediatric abusive head trauma training, which includes the 10-4 faces P bruising role here in Kentucky. To be able to give that training, I think is a really helpful, starting point for other physicians, nurses, EMS workers, within that profession, especially. Thank you. Awesome. I'm not seeing any other Uh, questions. Appreciate Michelle, you saying you wanting to get a local plan going in your community. Appreciate it so much. Thanks, Dr. Chuo, for the feedback. Appreciate you.
Mara, can you put your email in the chat?
Sure, I can do that. And I'm going to go ahead and turn it over to Clarissa to close us out for the day.
All right. Thank you. Hi, everyone. I'm Clarissa. I'm with the Face It Movement as well. I'm on the communications and marketing team. So, what I'm going to talk about is what to do next. So, in preparation for TEN-4, you can attend a pediatric abusive head trauma and TEN-4 faces P bruising rule training. You can receive CEUs if you're in Kentucky. If you're not, you can still attend. That's fine. It's a really thorough training. It's interesting to learn if that's something you'd want to bring to your state. You can sign up on the link that I put on the TEN-4 faces P bruising rule page. There are the 3 registration links. You can also secure a proclamation which recognizes October 4th as TEN-4 Day, as Mara talked about before. The templates are on the web page. They're kind of in the middle of the page, and it breaks down exactly how to do it. You can host a positive parenting event, which Debbie briefly talked about, and you can contact Debbie, and I believe she did put her email in the chat about what that looks like and the process that you can go to apply for stipends and things like that. You can also help us by spreading the word on social media and in the news. So take a look at that social media toolkit. There is suggested language that you can use and photos and flyers, graphics that you can download. Feel free to, take what you need, leave what you don't, and then tag us on social media so that we can know what you're doing and we can help share your content as well. Engage with us on social media. It's usually me behind the screen. So if you have any questions, you can feel free to shoot a DM. And then also, if you're new to this, I would just suggest picking one thing that you can do to start getting involved. There are so many things that you can do to prepare for TEN-4, for the day, on TEN-4 day, and after TEN-4. So just pick one, start with that, and then go from there. If you have any questions, our emails are in the chat, and you can just reach out to Debbie or Mara, or if you need to contact me, you can do that through social media.
All right. Thank you all. We appreciate you taking time to join us today to learn more about TEN-4 Day, and we look forward to connecting with you all further.